pn-tpl-1. A male client being treated on a mental health unit becomes angry and belligerent toward the nursing staff after an argument with a family member. If the client's anger escalates after alternative measures fail and he refuses a PRN sedative medication, the nurse has which of the following legal options? The client has the right to refuse the medication and the nurse must respect the client's rights. B. The nurse can administer the PRN sedative to protect the safety of the patient and others. C. The nurse must contact a probate court judge and get permission to administer the medication. D. The nurse should contact the hospital's attorney related to the client's right to refuse treatment. 1. B. The nurse can administer medications to a client against his or her will when the circumstances indicate a potential for danger to the client or others. The nurse must provide objective and complete documentation describing the circumstances and the failure of alternative measures. Choice A is incorrect. Under most circumstances, the nurse should respect the client's right to refuse treatment. However, when the circumstances indicate a potential for danger to the client or others, the client's rights are waived. Choice C is incorrect. The nurse does not need to receive permission from a judge to administer the PRN medication. Choice D is incorrect. The hospital's attorney does not need to be notified. Category Safe and Effective Care Environment Coordination of Care Subcategory Mental Health 2. The nurse is assessing the growth and development of a toddler. The nurse knows that according to Erik Erikson's stages of psychosocial development, the toddler is in the stage of A. Autonomy versus shame and doubt. B. Industry versus inferiority. C. Initiative versus guilt. D. Trust versus mistrust. 2. Autonomy versus shame and doubt occurs during the toddler years. Choice B is incorrect. Industry versus inferiority occurs during the school age years. Choice C is incorrect. Initiative versus guilt occurs during the preschool years. Choice D is incorrect. Trust versus mistrust occurs during the infant period. Category Health Promotion and Maintenance Subcategory Pediatrics Growth and Development 3. The nurse is coordinating care for a woman who is 6 hours postpartum for hemorrhagic shock. The nurse knows that symptoms of hemorrhagic shock include A. Cool, clammy skin. B. Lachyerabra. C. Urinary output, 30 megaliters per hour. D. Uterine cramping. 3. C. Urinary output of less than 30 megaliters hour is indicative of inadequate organ perfusion and oxygenation and can be an indicator of hemorrhagic shock. Choice A is incorrect. Cool, clammy skin is a symptom of shock. Choice B is incorrect. Lachyerabra as the term ml/hour is indicative of inadequate organ perfusion and oxygenation and can be an indicator of hemorrhagic shock. Choice A is incorrect. Cool, clammy skin is a symptom of shock. Choice B is incorrect. Lachyerabra is the term for the normal, red, bloody vaginal discharge that occurs in the first week after delivery. Choice D is incorrect. Uterine cramping in the early postpartum period assists with involution of the uterus and is not indicative of hemorrhagic shock. Category Safe and Effective Care Environment Coordinated Care Subcategory Maternal Infant Postpartum 4. The nurse is caring for a client with hypertension. On the illustration, identify the area where the nurse will place the stethoscope to best auscultate the pulmonic valve. 1-2A, 1B, 2C, 3D, 4 4C. The pulmonic valve is best heard at the second intercostal space, at the left sternal border. Category Physiological Integrity Physiological Adaptation Subcategory Cardiovascular Disorder.